wash my hands. And I say, hi, my name's Kristen. I'm going to be your nurse today. Mrs. Ashworth, can you verify your name and date of birth for me? I thought she was gonna do. Tanya Ashworth, 12/4/1968. And do you have any allergies? No allergies. So, depending on what this patient's mood is, what she's here for, if she wants to chat, I may just chat with her, because again, you can learn a lot about your patient by just talking to them. So if I've determined already that I know she knows why she's here, she knows the date, things like that, then I don't have to ask them again. But if, you know, she's lying here and she's kind of confused, I'll say, tell me, why are you here? And she'll tell me. And if I'm still kind of like, do you know if you're in the hospital? Do you not? I'll say, where are we? And then I expect her at that time to know that she is in the hospital. Then I'll ask her, do you know the month and year? Again, if she can give me the year, we're probably okay. So then I'll tell her, I'm just gonna have a look and listen to you. So as I'm talking to her, I'm already kind of doing my assessment. So I don't need to look at every single part because I'm doing it as I'm talking to her. So I'll start, where did I put my pen light?
Right here.
Oh. And again, depending on what kind of patient this is, I might do a different exam on every patient. But I'll look in her eyes.
And you touch their eyes, guys.
And then I'll tell her to follow my light and make sure that she can follow me. And that's essentially this part. I'm looking at her mucosa, I'm looking at her eyes to make sure there's no drainage, her ears, everything. But there's really not a whole lot that I need to do. I, as a rule, normally am not assessing carotid pulses unless there's a need to. So if I'm on a cardiac unit, then I may do this, and I may also listen to her carotids. I'm also looking for that JVD, the jugular vein distension.
You need to put a pair of gloves on.
Oh, I had them. Oh. It's much easier when it's a real human being that you know that you don't want to touch.
And guys, when you're checking the eyes, you've got to be able to tell us what size the pupil is.
All right, so I'll tell her, I'm just gonna listen to you breathe. If you can take some nice deep breaths for me, every time you hear you feel my stethoscope move, just go ahead and take a deep breath. And then I would come to the sides and listen to her. And then at that time, if I could, I would have her sit up so that I could listen to her back. If she is obese and I'm the only one in here or whatever happens, I may save that for later when I have help with me, okay? And then I'll say, I'm gonna listen to your heart. You can just breathe normally. Okay. If I have a reason to, I will palpate the chest wall in case she's got some crepitus, some subacute emphysema, something like that. So then I'm gonna cover her up here, and then I'm gonna come down. So I'm looking at her belly. I'm seeing if there's any waves, any distension, anything. And then I'll say, I'm gonna have a listen to your belly. If I haven't asked her about pain yet, and this, I am a GI/GU nurse, so usually all of my patients' pain is right here. If I have not asked her about pain yet, I will say, are you having any pain? Yes or no. On a scale of 0 to 10, 0 is no pain, 10 is the worst pain that you've ever had in your life. How would you rate your pain? We usually will have a conversation like that right when I go in there for the first time, just talking to her about what her tolerable level of pain is, depending on what's going on. You know, that may be one of our goals for the day, is to get the pain to a tolerable level or whatever it is. So I inspect, and then I listen to her belly, starting in the right lower quadrant. And how long am I going to do this for?
A minute.
Okay. If I need to palpate, I will, but again, it depends on your patient if you're gonna go around pushing on their belly. So then I'll say, Mrs. Ashworth, can you squeeze my fingers? She might give me a little squeeze. I'll say, please squeeze as hard as you can. Okay. As I'm kind of talking to her and we're doing this assessment, I'm seeing how she's moving her arms and if we need to do any more assessments like that. So I'll cover her back up, and then I'm looking at her legs. I'm looking for any lesions, swelling, drainage, things like that. I am going to check her posterior tib, and then I'm also going to check her dorsalis pedis, and then I'll check the strength on the feet too. So I'll come up here and say, can you push against my hands as hard as you can? And then we'll come down this way and I'll say, can you push as hard, against my hands as hard as you can? That's essentially it for the front half. But I still need to make sure that I've done a thorough skin assessment. So if she can roll over, I would roll her over and look at her whole backside. Sometimes, again, you have to wait until you have somebody in there with you to roll her over or whatever it is. If it's a patient who I know is incontinent, I will probably wait until, because I know I'm going to be in there multiple times cleaning her up, and that's a great time to do a skin assessment. If it's a patient who needs a full bath, I might tell my tech, hey, let me know when you want to go in there, we can go in together. That's an awesome time to do your assessment because you're looking at every part of them and you're also helping out your tech get the bath done. So that is essentially my whole assessment, depending on what the patient has going on. So again, if it's a neuro patient, I might do a more thorough neuro exam. If it's a cardiac patient, I may do a more thorough cardiac exam. If it's a post-op, we're gonna look at their wound, if they need dressing changes, all of these different things. But that's just a very basic. And then I'll say, please let me know if you need anything. I'll be back in an hour, 30 minutes with your meds, whatever it is. But before I leave the room, I'm gonna check and make sure that she doesn't need pain medicine. She doesn't need to go to the bathroom. She's got our call light with her and her TV remote and whatever she needs. so that she's not calling me back in 5 minutes asking for pain medicine. And then I'll put her bed down, we'll make sure that she's comfortable, and that's it.